No academy, no paid courses, just strategy. In this video, I'll be telling you exactly how I passed the National Clinical Assessment Test, and at the end, I'm going to be answering some frequently asked questions about the NCA. My name is Eshe-Ann, and I wrote my exam on the 6th of November 2025, and glory be to God, I passed my exam. My results came out on the 27th of November 2025, and I did pass 11 out of 12 stations, scoring maximum marks in 4 stations. So to pass the NCA exam, you need to pass at least 9 out of 12 stations, and your cumulative scores should reach a particular set mark, which for this year we weren't told. Why did I write this exam? So the NCA is organized by the UKFP, and everyone who have graduated more than 2 years before the start of the foundation program needs to take this exam. So I graduated in July 2023, and I'm currently applying for the UKFP 2026. Hence, I would need to write this exam. Hence the need to write this exam. Oh my God. Before you start your prep, you need to know what the exam is about, and I feel like the best way to do this is actually going through the documents the UKFP will send you in the first week of October. This document has candidate information, what dates you're going to be writing the exam. They also have some PDF information containing the scope of the exam, what to expect, test information basically. Going through the document helped me to understand like the different station types. So we can have things like breaking bad news, focus history taken, seman, practical procedures. I think understanding the type of station by looking at the prompt is going to go a long way in helping you when you get into the station. For example, the only station that I failed in the NCA, I think I failed that station because I failed to recognize what type of station it was. So rather than a challenging communication station, I took it as a counseling station, and then my manner of approach, the way I structured my station was just towards counseling. So I feel like that's what affected my mark. I think everyone needs a study group. Some people do well studying on their own, but I feel like since this is an OSCE test, you're going to be interacting with patients, you need someone to simulate the exam for you. So my study group, we had like study sessions where we meet at the library. We did a lot of examination stations together. We learned some practical procedures. So we did go to an academy. So at the time, practicing in the academy was free. So if you're in Manchester, be sure to check them out. So shout out to Dr. Arfan. Thank you so much for letting us use your academy, your practice space. It was really helpful towards our preparation. Oh my God, I'm straight up. NCA Telegram group. There are a bunch of them. There are a lot of them. If you go to the document part of the NCA Telegram groups, you can find like frequently tested stations in the NCA. You can also find like topics that you can read on, the scope of the NCA as well, things that will really help in your preparation. You can scroll up to previous years, those who took the NCA, what was their experience, what were they saying about the exam. So all of this helps a lot. Another resource that helped me a lot in my preparation was Geeky Medic's free YouTube videos. I use their free videos for my examination stations. Examination can be a bit challenging because there are a lot of examinations and you need to learn each one since you don't know like what particular stations is going to come in your exam. So what I can suggest is that you take out time to practice these stations. You can have a practice partner maybe in your study group, and then you do it over and over again. At the beginning it may seem difficult or complex, but as you practice them over time, you get a hang of it. And I think something else that helps me in my examination stations is that rather than just putting everything in your head, like just cramming all the steps, you need to understand what each step is for. Like, why are we checking this in relation to the system? For example, in the cardiovascular exam, you have to feel the warmth, the temperature of the arms. So now, why am I doing that? You know, in myocardial infarction, you can have cold clamping extremities. So that is why I need to check the temperature to rule that out. So I feel like understanding why we're doing this step for this system is going to help you to get like a better flow of your exam. I don't know if I'm talking a lot, but I hope someone is picking what I'm dropping down. Anyways, ChatGPT. believe it or not, ChatGPT is that girl. Unlike PLAB 2, that there are a lot of PDFs out there, a lot of pro formats, the NCA, there are not a lot of exam prompts out there. So you can use the ChatGPT to generate prompts. When I'm practicing with my practice partners, I just text ChatGPT that, okay, I'm trying to, paint a picture of assessing, for example, assessing mental capacity. I need a prompt that would help me test. Oh my God. I need a prompt that will help me test the presenter on this aspect of the NCA exam. So it will generate a prompt like, for example, Alex, he's bleeding, and then you simulate for your presenter. Also, ChatGPT helps me a lot in the management, how I should structure my management, how to arrange it in a way that makes sense, in a way that my examiner would follow through. It also helps me in explaining concept. For my PLAB 2, for my NCA, anything that I don't really understand, or I read something and I'm like, what's this? Why are we doing this? ChatGPT will just explain further why we need to do this for this. The fifth thing that helped me a lot for my exam, it's called OSCE Stop. OSCE Stop Revision. Yeah, I'm going to put a picture up, and it's like this OSCE textbook. It has a lot of OSCE stations. I feel like when you're using this material, you have to be as focused as possible, especially if you're pressed for time. Okay, you can't be reading everything when you have just limited time and you need to be focused. So you should know what comes out in the NCA that you can find in that textbook. That textbook is going to help you in structuring your station, how you should flow in the stations, and it's also going to help in some Viva questions as well. So I found that very helpful. The last resource I used was Sarishka's guide. I think I found out about it on one of these NCA groups. So the free PDF was available, and then I looked at it. So she kind of described how each station went, and I had a mental picture of what the NCA should look like. How much time should I prepare for the NCA? If you've done the PLAB 2, I think you need maybe 2 to 4 weeks or even less. However, if you've not done the PLAB 2, you need more than that, because you need to learn how to structure your stations. For example, you need to learn how to take a detailed history, how to do some examinations. You need to learn the practical procedure. In a way, PLAB 2 and the NCA overlap each other. So some stations from the PLAB 2 will most definitely help you in your NCA. Should I take an academy or should I not take an academy? Well, I think the choice is entirely yours, especially if your finance would allow. But I can assure you that you do not need to take an academy to pass the exam. You just need serious practice partners. You need to understand what the exam is about, and you need ample time to go through the stations. Be on those Telegram groups and be active. Always watch out for information, free classes, textbooks flying around. It's very important that you have a community, okay? Try to have study partners. It may be difficult, especially if you're introverted. There were these free classes organized by Dr. Chidi and Dr. Bayo, so I made sure to attend each and every one of them, and I did learn a lot, especially for prescription, IV fluid. So I think you should stick your neck out, because they may have free classes just before the NCA exam in November. So I think the NCA is definitely doable. I think it's very important to be as focused as possible. We all know that the NCA does not contain stations like pediatrics, obs and gyn, dermatology, especially if you're pressed for time. I do not think that you should be studying on those things when you can study on more frequently asked concepts in the NCA. Also, I would advise that you do not underestimate the NCA at all, because I've heard it a lot that, oh, the NCA is easy, it's an easy exam, you can do it. But I think it's one of the most important exams in the United Kingdom Foundation program, because God forbid, if a candidate should fail the exam, they have to wait till the next year and they have to apply again before, so it's a one-time exam. So just give it your all, try your best, and I believe that hopefully using these tips and your own tips or your own advice to yourself, you should be able to pass the exam. Any question that you have, you can just leave it down in the comment section. Anything that you would like me to re-explain. So I've come to the end of this video. Thank you so much for watching, and I wish you all the best in your exams, and hopefully you would clear your NCA and be admitted into the UKFP for whichever year you're applying to. So yeah, thank you guys so much, and bye.